Welcome to the new Shonan Hospital, and welcome for the first, probably the first of this year, and hopefully into next year, of combined conferences again. They've always been very popular in the past, so I hope we can continue. Presenter tonight is Dr. Narita, who's been working very hard on his presentation, and I hope you find it interesting, and it's kind of a diagnostic quiz. So if you have any ideas, please shout out. And without further ado, over to Kim.
Good evening. Thank you very much for coming to Shonan Kamakura General Hospital. Welcome. I'd like you to present a very complicated case for us. So let's start it. Identification. 79-year-old man, and his chief complaint is fever. This is history of present illness. PTA means prior to admission. 1 month prior to admission, patient underwent prostate biopsy due to an elevated PSA, about 11, to exclude malignancy. 3 days later, he had a 38 degrees Celsius fever, and the urologist diagnosed it is an prostatitis, so the levofloxacin for oral was begun, but the fever continued. And 20 days prior to admission, I went to urology for suspect of prostatitis continues, and the ceftriaxone IV was begun. But the fever continued, and consulted to the GIM and transferred to a GIM ward. If you have any questions, please give me a. He had appetite loss for 1 month, and he had no night sweats or chills, and he had no weight loss. This is his previous medical history. He had tuberculosis and gastric ulcer and benign prostate hypertrophy and proximal atrial fibrillation.
I have a question.
Okay.
When did he have tuberculosis?
Tuberculosis when he was 20. When he was 20.
How did he treat?
He didn't remember precisely. Any questions and comments about the history of present illness and past medical history?
So do you have levofloxacin for 20 days?
Levofloxacin, not for 20 days, and about 2 weeks. 2 weeks levofloxacin for oral, but his fever cannot coming down, so they decided to admit him to a urology ward. Any other questions or comments, please? Okay, go on to the next slide. His medications, he's taking warfarin, about 4 milligrams, and bisoprolol, about 20 milligrams, Savandrine succinate, 50 milligrams per day, Nicondale, and 10 milligrams per day, and omeprazole, 20 milligrams, and no drug allergy. Social history. He's been smoking for 20 cigarettes for 30 years. And he likes to drink alcohol, Japanese sake, 320 ml per day for 30 years. This is his review of systems. His general appearance, general condition is not malaise, and headache, eyes, nose, throat. He had no headache, pharyngeal pain, rhinorrhea, or dizziness. On cardiovascular system, he had no chest pains, palpitations, or dyspnea. On respiratory systems, he had no coughs, sputums, hemoptysis, or dyspnea. Abdominal system, he had no nausea, vomiting, heartburn, abdominal pains, hematemesis, bladder, diarrhea, or constipation. On genitourinary system, he had no frequency, polyuria, nocturia, dysuria, or hematuria. On musculoskeletal system, he had no myalgia, joint stiffness, or joint swelling. At dermatological point, no skin rash, swelling, or nail problems. So this review of system shows no symptoms for him. And this is his vital signs. His blood pressure was 122 over 64 millimeter mercury. Heart rate 85 per minute and regular. Respiratory rate 18 breaths per minute. The FiO2 95% on room air. And body temperature was 37.5 degrees Celsius. Right. And this is his physical exam. On the exam, general appearance, he's slightly unwell and conjunctiva, no pallor or jaundice. His neck, no meningeal signs or lymphadenopathy. His pharynx is clear, no swelling, no erythema or exudate. And his head, I couldn't feel temporal artery tenderness. And there's a continuous his physical explanation. Cardiac system, heart sounds are normal, no added sounds or no murmurs or no gallops or rubs. There's no rubs in him. A respiratory system, percussion is resonant, erectile scrotation bilaterally. And on the abdomen, softened fat, bowel sounds normal, no tenderness, no rebound, no hepatospread nigri or Murphy signs are negative, and severe tenderness negative. We also did an electro exam, but he had no tender, and fecal blood was negative. On extremities, he had no edema, cyanosis, skin rash, or peripheral signs. So nothing particular on the examination. So just looking, slightly ill. And our physical exam continues. Muscle and joints, no swelling, no deformities or muscle wasting. And lymph nodes, no lymphadenopathy in the submandibular, cervical, supraclavicular, axial, or inguinal area. So this is his laboratory studies. Pulsal counts 5,000, neutrophil 53.2%, lymph slides 26.7%, monocytes 14.8%, eosinophils 4.4%, basophils 0.9%, and hemoglobin 10.6%, MCV 87.2%, platelet 50,000, PT 20.3, INR 1.76, EBD is 59.2. LDH was 774, AST 31, LT 19, gamma GDP 68, alcohol phosphatases 567, the ferritin, 2411, and BUN 15.6, creatinine 1, sodium 135, potassium 4.6, calcium 8.5, ESR1 now 32 centimeters, and TSH 33.4, mercury equal 1.5. Any questions or comments?
Question now. Does the patient have any social history?
Social histories,
Like,
what do you mean?
swimming in the river or any interesting findings in social histories?
No, not swimming liver.
Okay.
His job, occupation, is in a heavy industry. Usually, I don't know, renting heavy industries. For example, renting cranes or renting
Okay.
shovels or like that. So his work is mainly office and office jobs. Urine analysis, this is normal, pH 6.0, protein, urine glucose, rubinogen, bilirubin, ketones, local blood, WBC, OBC, urine cast, bacteria, they are all normal. This is an ECG on admission. And heart rate is 98 and rhythms regular. And axis, normal axis deviation. And SCT, no change. And on B1, we can see an incomplete right bundle construct. But yeah, I think the ECG otherwise normal. Any comments on ECG readings?
So we can see incomplete right bundle blood and invertility in the 3 and 3-1 and D2. So just I suspect that the patient could have some right-sided stress or some pathophysiology due to some like pulmonary hypertension or something like that.
Okay, thank you. Another comments or questions?
What don't you see on this EKG?
Oh, what?
What don't you see? This patient is a 79-year-old male with a fever. What does an EKG help you?
Oh.
What are you looking for that's either not here, which is good, or
regularly, in this hospital, regularly on admission, we take an ECG on all the patients. So this is, I like to show the ECG.
but I assume that if there would be findings that you would look for, depending on what maybe your differential diagnosis is. So, for example, if he had ST elevations throughout the whole thing or something like that, and he had a rub on exam or something like that, what is that telling you?
Oh, this is EKG?
Not this one, if that was present. I guess what I was getting at is I assume that some of the tests that you get, you are looking for specific things. Right?
Oh, you're looking for the specific things.
What diagnosis is this going to give you? I don't disagree in getting it, and if it's normal, it is, but like for example, I don't know, maybe this guy has endocarditis or pericarditis that affected something around his heart.